There we go. That's the prep and what it consisted of. And frankly, what it consisted of was mostly just roughening the surface and getting firm, solid tooth structure. Then what we do is we take a contour strip, we fold it in half, we bend it back so that it's shaped like this. We then will bend these little, what are called interproximal corners in. Okay, and so they actually bend in like this. I'm not sure if you can see that. Okay. We then take a mirror handle and we bevel this out like this so that it actually has a curve out, like that. We then will take that and put that between her two teeth. And in her case, this was rather lucky because she has relatively light contacts, and so it went in very nicely. If it doesn't go in very nicely, which is what the normal occurrence is, then what happens is you can take a spoon and you can actually push the teeth apart and put the contour strip in that way. The way the contour strip works is it actually fits in, goes down next to the gum tissue, goes under the gum tissue, which is what allows it to keep real nice and clean, and then we put cotton. Go ahead and turn your head this way, Phil. Great. We'll put cotton.
That's probably not big enough, huh?
That's fine. In between the interproximal areas to hold the contour strip tight against that to avoid having any overlap or overhang in the interproximal area. Now on this side, I really want to make sure that we close this embrasure, so I'm going all the way through, and then I'm actually pushing the band out so that we get the contour that we want to have on that tooth. Now you'll notice now it's there, but it's kind of flimsy and it's not holding in well. So what I do in my office is I go through and take some unfilled resin, and we go through and we put it around the outside of the band. Not quite yet. I hold the band where I want it. Okay. And then we cure it. So now what we've done is we've made a very good form for our composite. Okay. Now you'll notice this is nice and firm and solid. What Dr. Belvedere recommends is cutting off these edges. I generally find that I like to leave them on. We're going to go ahead and etch. I happen to use a very thin gel etch, and I'm etching just the enamel. Now I'm using a brush because I can control where it's going better. We let it etch for, in my case, because I want good bonding, I'm actually letting it etch for 20 seconds. We rinse it off very well. And then we dry it. You'll notice the nice edge pattern on the enamel. Then I'm using Liner Bond 2, which is very close to the Prelude that you guys are using, but you'll notice I'm using a brush rather than a micro brush. The brush, actually, the bristles will get in and get everywhere where I've got isolated with the band, whereas the micro brush is too big and too bulky to fit into those areas. So I recommend, if you're going to be doing a class 3 like this, where you're down at the gum line, that you actually go through and use this brush instead. Go through and make sure that we go through and remove all of the solvent, and then go and put our bonding agent. Now, this would be a situation where you wouldn't use the link because there's nothing that's going to be chemically cured here. Thin it, light cure it.